Okay, perfect. Welcome back. Thank you very much for being here. So our next panel is use cases, data potential, and limits and challenges. Our first panel is going to be Hamish Patten. Hamish, you'll have the word.
So thank you very much for having me. Thank you to Crisis Ready, and thank you to the translation team. You're fantastic. So I landed on Saturday, and on Sunday I got sunburnt. So I'm stereotype of the English #1. And yes, I will smuggle 5 liters of mezcal also to England. So okay. So the focus of my work is really on the early stages of displacement. So when a rapid onset hazard occurs, trying to predict a spatial distribution of the displaced population. And it's quite simple in terms of the model. We try to be as simple as possible. And here in the presentation, I'll give you a quick example of the earthquake in Haiti, and in cyclones, Cyclone Harold, which passed over Vanuatu in 2020. Okay. So if we look at this image, it actually talks about 2 different variants. So on the left, if you talk about the number of people that are located in the evacuation shelters, it talks about one thing. And for buildings damaged, it talks about something completely different. So this example, what we're looking at here, was actually a volcanic eruption in St. Vincent in 2021. Oops, I've forgotten now. And the red cross marks the volcano location. And what we actually notice is that on the left, we're talking about where are people displaced to, so their location, and on the right, displacement origins. And essentially, you can use different data sets to understand these two. And I think everybody here is pretty familiar with this. Really, one of the key parts to displaced location is nowadays the new sort of technologies that have already been discussed is this mobility data and combining it with different sources. And on the right, oh my God, I can't breathe. And on the right, I'm just suffocating during this presentation. And then on the right is a lot of sort of satellite imagery, which I'll talk about in my presentation tomorrow. Okay, so the aims of this presentation is, so my work focus is to predict displacement origins. And what you can do is you can combine this with mobility data, so making inference. You're not so much making predictions anymore, but of the rate of return. And as I said, focusing on Haiti, Cyclone Harold, and finally, at the end of this presentation, I'll run to the computer at the end of the table and show you some plots of what happens when you have sex disaggregated mobility data and how you can use this to combine it with spatial displacement predictions to understand rates of return. Okay, so we have 2, this is quite fast, okay. So we have 2 main sources of the validation data in this work. So the first one is displacement. Yeah, are you trying to max screen it?
For those of us who are remote, we cannot see. Oh, now we can see the presentation. Thank you.
Well, there was nothing much so far. Obviously, I'm going to say that.
Thank you. Thank you, Andy. Thank you. Apologies for interrupting.
Is there any chance that someone could stay near the computer to just make sure it goes, or if you could put it full screen? Yeah. I mean, I can move it, but like a whole section. Okay, so yeah, if you could just like alter it to make sure it fills the screen when I scroll down, that'd be fantastic. The one to the right, is that one? Oh yeah, and if you scroll just enough, it should be, scroll up a bit, up a bit. Okay, right, so in this work, we combined there are 2 types of data. One of them is the total number of people who were displaced over an earthquake. And this includes 157 earthquakes in 47 different countries over a decade. So this is how we're really trying to be able to predict accurately the number of people that are displaced after an earthquake. And there are several earthquakes in Mexico that were included in this data set, including their pre and aftershocks that were above 5 on the modified Mercalli index. The next step, which I'm going to talk about tomorrow, Andy, could you scroll up? Thanks. So this is a bit of a teaser for tomorrow, is how you can use satellite imagery to compare. I mean, this is one example of it. There are loads of different examples. You can compare images of buildings before and after, and you can understand, you can classify them as levels of damage, you know, minor, major, etc. And for this, we have 270,000 buildings that were assessed for damage in 20 earthquakes in 14 different countries. And essentially, this helps us to ensure that our spatial distribution of where we're estimating building damage and therefore displacement origins, that we're trying to predict as accurately as possible. So this next, actually, would you mind if you scroll down and I just tell you next slide? So it's quite simple, the model, yes, scroll to the next. It's quite simple, this model, it just layers different data sets that include population, hazard, and sort of proxies for socioeconomic factors. And here on the right, this is the example for Haiti. So you have the hazard intensity on the contour plot lines, and as you go closer in, you're seeing that hazard intensities move up to around 8, 8.5 on the modified Mercalli index scale. And the actual contour plot is for the population data. And what we see here is in the area that is the highest hazard intensity, which is a region called Leke, is actually where the largest, the highest population density was, which is why we saw such catastrophic consequences of the disaster last year in August 14th. Next slide, please. And here, if we zoom in, the model is pretty simple. Just at a grid point to grid point scale, you are making a prediction using the population, using the hazard intensity, how many people are going to be displaced at that grid point, and you aggregate it up to the whole country, etc. And multiple countries is done as well. For example, the Nepal 2015 earthquake. And then you can compare to the estimates that were made that will come from data sets such as the Internal Displacement Monitoring Center, IOM, etc. Okay, next slide, please. Next slide, please. So here, Renee, I'm sure you recognize this. This is probably really outdated. So Renee, I should have really asked you beforehand. But on the top, we're seeing, so it's not a comparable like for like, which is why the next slide, which don't go yet, please, is a more representative comparison. But here you sort of, so on the top, we're seeing number of families in need. And on the bottom, we're seeing this displacement prediction from the ODRIN code, which is what I've been working on. So you can kind of see that, for example, in the high hazard intensity regions, there are a larger number of people displaced. And this tends to correspond with areas of high humanitarian aid requirements. Next slide, please. Next slide, please. So, to make a more accurate, quantitative comparison, we have the sort of predicted values, and they're disaggregated by region, and you can go further, but there's no point in showing that today. And our comparisons for this Haiti, and we did it for many different earthquakes as well, out of the 157 earthquakes, and this was just the most recent one I'd worked on. But the comparison is fairly reasonable. Now let's look at the satellite imagery comparison. So if you scroll to the next slide, please. So this is from UNISAT, UNITAR, and Copernicus, where there's satellite damage classifications. From 1,400 buildings, we had a comparison which was 77% of buildings classified as minor, major, and no damage. Next slide, please. So we're doing fairly well. And then finally, a little bit lower, please. A little bit lower, please. And yeah, okay, so actual total number of buildings damaged as well. We have a fairly reasonable comparison, it sort of sits in that realm. Next slide, please. So let's move on to tropical cyclones and how you can combine mobility data to get a further insight, coupling it to this spatial distribution of displacement origins. So next slide. This was a video. It doesn't work because I use Linux. So next slide. I'm not paying Windows any money, especially since the divorce. I'm particularly touched. Okay, so in this slide, we are seeing a displacement from, it's actually simulated data. But, I've been working with Meta for the sort of displacement mapping. So here we have, I just chose to simulate for 6 different islands of Vanuatu for Cyclone Harold. Next slide, please. And what we have is, because, for example, Meta disaggregate by sex at birth, you have female displaced population on the left and male displaced population on the right. So this is, first of all, this is the predictions from our code. And actually, we just couple this directly to the mobility data per island that we have data for. So there are 6 islands that we've worked on. The rest, we sort of remove that data. Next slide. So this is day 0, and then next slide, please. And day 40, we see that this rate of return has changed. So I'm going to run around.
This is fun.
So what we're seeing here, hope everyone virtually can sort of see this.
Could you put your mic on, please?
Need any words? It's just. Yeah. I made a video, I promise. It's just it didn't work. Oh my God, so many images. Right. Could you go back to the presentation, please? Sorry, I got my workout for the day. Okay. So the whole point of this is that you, by coupling. Gracias.
La del PDF.
Ah, sí. Sí. Oh, right. And then final slide, please. That's fine. Next. Okay. So this work has been trying to combine aspects of displacement and building damage, so both prediction and inference. And my focus for the prediction was the early onset stage, first week, when you don't have data that's readily available, or often you don't have data that's readily available. And this was, so the first ever global displacement and building damage spatial mapping. It's easy to validate because of tools that are available like R and Python and etc. It's super easy to validate on total number of buildings damaged per region, using satellite imagery to compare for building to building, total displacement. We're working on mortality at the moment, for economic cost. These sorts of models are very simple. So the final issues are evidence-based vulnerability. How do you compare one country to another, one region to another? And actually vulnerability is just a really interesting realm when you have loads of different variables. So in World Bank, you might have 2,000 indicators, which I try to explore. And then it becomes a bit almost like, genetics. Which gene is important for this effect or this, phenotype? And actually, it's really difficult. So it's a very complex sphere. And at the moment, I have a master's student who's working exactly on this topic and trying to make it statistically significant. Future is where are people displaced to, these locations. So really working a bit more on the data, and hopefully by now Meta will have more data for me to sort of work on where people are displaced to. But to be honest, with the good work of fellow colleagues, I think, to be honest, where people are displaced to is not my highest priority. But thank you very much. Yeah.
We're switching seats. Okay. Sorry. Just jump right in. Okay. Hello, everyone. I'm Taka. You pull up my slides. All right.
This should work now.
Oh, yes. Okay. Okay. So, hello, everyone. My name is Takahiro Yabe. So I have two caps. My current cap is a data science consultant working for GFDRR, which is a unit within the World Bank. And I'm also a postdoc at MIT Media Lab working with Sunny Pentland on using mobility data for socioeconomic resilience and modeling side. And today I'll be talking about post-disaster population displacement. So building up on the previous presentation and looking a little bit more on recovery and how can we use mobility data to further understand from how people's moving, maybe the economic damages and economic losses of businesses in the region. And as you can see in the title slide, I have the displacement map of Mexico City. So this was right after the Pueblo earthquake. So this was the pilot project that we were working on. So I'll talk about some of the applications that we came up with around this disaster. And so unfortunately, Nick Jones, who is the team lead of GFDR's team, couldn't make it. He's in Tokyo right now. We kind of switched places. I'm in the US and he's in Japan. So yeah, so I'll be making this presentation today. So,
sorry to interrupt. Is there a chance that the presentation could be shared? It's blank right now. I'm really sorry.
blank?
Yeah, probably. I mean, it may be not blank on your side, but maybe because the application that you chose to share on WebEx does not correspond with the screen.
Okay.
I don't know. And if it's a problem, I'm happy to keep my mouth quiet from now on.
You're only sharing it.
Yeah, you're showing Edge, I think. Okay. I think we can we figure it out.
Thank you. I appreciate it.
Yeah, thanks. And yeah, by the way, Tokyo had a magnitude 7.4 earthquake a couple of days ago, and Tokyo is undergoing this blackout now. So I think we have a lot of common things between Mexico and Japan. So I think this is a really nice opportunity for me as well. So
Thank you. I can see it. Thank you. Sorry for interrupting.
yes, it was made by JICA, I think, made by the funds provided by JICA. So I see a lot of connections here. So. Okay. So at GFDR, we're focused on using the opportunity that we've been talking about, presented by novel GPS datasets, and to develop tools and use cases within the World Bank to inform urban and disaster risk management use cases. And so far, we've been conducting studies in Mexico, Chennai, India, with the transport team, Costa Rica with the urban planning team, and Kathmandu as well with the tourist analysis. So because COVID hit Kathmandu very significantly, they lost 8% of the GDP comes from tourist industry, and that took a very big hit. So we're trying to assist them with mobility data analysis. And yes, I'll talk about mainly the response and recovery phase today, but we can also look into the longer term prevention, mitigation, resilience outputs. So if you have any questions, maybe I can touch upon those later. I'll finally talk about the toolkit that we developed within the World Bank. It's called MobiliKit. It allows data scientists to take mobility data and produce these outputs that I'll be showing you today. So, and it's not working anymore. Could you go to the next slide, please? Thank you. Right, yeah, I think we've talked a lot about mobility data already, so I don't need to go into the details, but this is actual mobility data traces from Nick Jones. He provided his own data for us to visualize and plot. So you can clearly see, where Nick spent his time during the day, which locations he visited frequently, and by day of week, for example, how much he's moving around in the city of DC. Next slide, please. And once we aggregate all of that information for millions of people, we can understand the urban dynamics. And as we've discussed in the previous session as well, GPS datasets are convenient samples. So we can't reach out to individuals and ask them for GPS data. We have the GPS datasets, and we have to make sense or make sure that it's unbiased as possible sample so that we can get accurate insights from them. So what we typically do is we compare how many people have been observed in different geographical locations, like localidades in Mexico, in the case of Mexico, and we plot the actual population from the census on the x-axis, and on the y-axis we have the number of mobile phone users, and we see that there's pretty good correlation between them two. So those are some of the analysis that we do to check the accuracy of the data. Could you go to the next slide, please? And yeah, I'll talk about some of the outputs that we got from the Puebla earthquake, which occurred in September 2017. This was actually our first pilot project within the bank. More specifically, I'll talk about how we measure population displacements and return patterns. We'll take also an income inequality angle to it, so compare between different income classes, how much displacement movement changed or differed between them. I'll slightly touch upon the predictors of population displacement, which kind of mentioned. So what kind of social demographic variables are predictive of how much population displacement you get after a hazard. And then the final application I'll touch upon is how we can measure disruptions and recovery of local businesses using mobility data. Go to the next slide, please. So one of the first things we do, not to get too technical in this part, but we can estimate the home and the office locations of individual users by taking their daytime and nighttime stay points and applying a clustering algorithm. So typically we take nighttime stay points and we cluster them to estimate their home locations for individual users and their daytime for work locations in the weekdays, not the weekends. So could you go to the next slide, please? And then the first kind of application we typically do is to look at population displacement mapping. And to do that, we first compute the average and the variation of these population maps, dynamic population maps across. If you can get 2 months of data, we'll use that. But typically, we get 1 month of data before a disaster event. So we take the mean and standard deviation of these maps. And can you press the next? And then we compute something called the z-score, which is the population map, how much the current population map is different from the mean, and considering the standard deviation of how much variability we see in the normal times. And we get something like this on the right. So could you press it again? Yeah, okay. So what we see here is that we see a very low z-score less than around -3, which indicates that these areas in the middle experienced significant population displacement. Sorry, could you stay on the, sorry. Yeah, from Mexico City on the night of the Puebla earthquake, and we can produce this for all the different time slots that we have, that we are interested in after the shock. You go to the next. And we can, as I said, we can produce these maps, displacement maps for different times of day, and also we can aggregate them daily. And so here I'm plotting the date on the x-axis and the displacement rates on the y-axis. So 2.5 means 2.5% of the population were displaced from their original home locations. And as you can see from the day of the earthquake, has the maximum amount of displacement, and it gradually decreases across 2 to 3 weeks from the actual shock. Could you go to the next slide, please? And one of the kind of analysis that we could do to further understand why different places have different displacement rates is to regress them by social demographic and socioeconomic variables. So what we did was we produced a poverty index, which is a composite index calculated by if you own a vehicle, if you own a fridge, if you own a computer, how much access do you have to education and health services? And we produced this poverty index for different areas, localidades. And then we regress that with the displacement rates from each of these areas. We find that there's a negative correlation indicating that poor people apparently lacked transport and financial means to vacate from these areas, and they were more likely to shelter in place. So we can get these insights to inform policymakers on where should they locate their evacuation shelters, for example. Go to the next slide. And the last application I want to kind of share is when we combine human mobility data with point of interest data. So OpenStreetMap is a very popular kind of data set. It contains a lot of data about, where the hospitals, where are the schools, where are the businesses. If we combine them, we can start answering questions like, how many people are visiting these businesses after an earthquake? Were they disrupted? How much were they disrupted? How quickly are they recovering? And also we can understand who are visiting these POIs, right? So are they only rich people visiting these places, or is it a mix of rich and poor? So can you go to the next slide, please? This is one example we did in Chennai, India. So kind of moving away from Mexico City here. But if you look at the blue bars, blue vertical bars, that's when the cyclone hit Chennai, Cyclone Nivar, hit last year. And you can see, comparing the blue on the top panel, blue lines with the gray lines, you see compared to the pre-hurricane Cyclone Nivar trend, we see a decrease in the amount of people we see going to local stores. And if you look at the bottom panel, you see the actual percentage differences. So around 60 to 70% decrease was observed. And if you compare this with more larger supermarkets, there's a very big difference in how this negative economic impact impacted the local businesses. So if you compare supermarkets and local smaller businesses, we see that local smaller businesses had larger and longer negative economic impacts due to the cyclone. So we could further look at not just local stores and not just supermarkets, but we can look at different business sectors. We can see differences between urban and rural regions. Also, we can see how the size of the business pre-disaster affected their recovery trajectories. And we can get a lot of insights by combining POI data with human mobility data. So if you have any questions on this, I can answer more, but you go to I think it's the next. Okay, final thing I wanted to share with you is our toolkit we developed at the bank. It's called MobileKit, and it's basically a Python toolkit for taking in these raw GPS mobility data sets and producing the outputs that we shared with you today. And it's available free, and you can pip install using Python. So could you go to the next slide? Could you go to the next slide? Yeah, so that's all I wanted to share today. So we saw significant disproportionate effects after the Puebla earthquake and other disasters. And please use MobileKit with your mobility data. So thank you very much. Thank you.
Okay, me again.
Make sure that we have your something up from Mauricio this time.
I should say, lo siento, no hablar español. No hablo español muy bien. I'm very sorry. I am taking classes, but no one wants to hear my Spanish. The other one, please. Okay, I'm gonna Yeah. So we've talked a bit about today about infectious diseases because a lot of this data became available and the conversation has now kind of reached a scale, a tipping point because of COVID. And so, you know, we've talked a bit about that. I'm going to talk specifically about the reasons that we care about mobility data in the context of epidemics and a little bit about the issue of intersecting disasters where we now have, you know, hurricanes happening, but also people have COVID or whatever else. Next slide, please. Next slide. Yeah. Okay. So this is a disease map of the distribution of malaria cases in Cambodia. And it doesn't really matter what we're looking at, except that, you know, the darker red means there's more cases there. So epidemiological surveillance is different than other kinds of surveillance in the sense of how it's collected, right? So clinics and health facilities report data to a central database, and then the government, you know, creates these types of risk maps for themselves to understand where the disease is so that they can target their intervention. And so, you know, here we notice that there's this high burden of disease on the border. Next. There may be a second area with a lot of cases. Next. And then, you know, there are this patchy distribution in space. And so often we want to know how those places are related by human migration. Are people importing cases across the border? Are they coming in? Is that how we can understand the distribution of disease? And what does that mean for our interventions? Next. So a lot of public health decisions actually come down to denominator issues and resource allocation, right? So we want to know what the population at risk might be, and we want to know how that's changing. So all of these questions that we've been asking today about where is everybody and where are they going, where have they been displaced to, those are fundamentally denominator problems from an epidemiologist's point of view, right? What's my population at risk, how is it changing, and who are those people? And that affects your resource allocation strategy, whether in this case it's going to be bed nets, medicine, and so on, but it could be anything. And of course, during disasters, this is exacerbated, but in many countries, there are also highly mobile populations that are always moving around for labor migration reasons, and they are also have their own and similar methodological issues associated with migration. Next. So if we think along this scale of an epidemic, right? At the beginning of the epidemic, we have very high spatial heterogeneity because we have maybe a point source or a few places where we have cases popping up. And so this graph shows you kind of the lifetime of an epidemic and how you might use mobility data for each of the along the path of this thing. So at the beginning, you're trying to understand the risk of introduction events from outside. So you might be interested in international migration. And then you might be interested in like how people are moving around the country and what that might mean for the spread of a disease. When we have been talking about, Nishant presented a lot of the work that we did around non-pharmaceutical interventions, so lockdowns, travel restrictions, these kinds of things that we might do in the context of an emerging epidemic. Mobile phone data is very useful for monitoring that and trying to make sense of it, asking questions like, has travel decreased, and so on. And then towards the tail end of an epidemic, and I'm not going to guess whether we're at the tail end of COVID or not, but you know, we still need to know about repeat introduction events. We may need to monitor a more endemic kind of situation. Next. Next. So basically that follows this idea of in emerging infectious diseases, they have, you know, different types of issues compared to endemic infections that may have spatial heterogeneity or not, depending. And then in elimination phase. So depending on where you are in an epidemic, and that's a local thing, right? So one thing that COVID has really taught us is that these epidemics are local. Countries are following their own trajectories. And so we really have to kind of understand where we are in that epidemic cycle. Just to bring it back to my own subject, the components of transmission, you may have heard for the first time in the news about the reproduction number, which we were all very excited about in my field. But essentially, you can break down the components of transmission into these three parameters: the probability of infection given contact, so how contagious something is, how long you're infectious for, and then the contacts per unit time. Next. So these two are biological and epidemiological parameters. They vary depending on the pathogen that you're dealing with, but they're kind of epidemiological parameters. Next. This is the one where the mobility data is really important. Contacts per unit time. So how are people mixing in a way that transmission can happen or not? And how are people migrating between places and spreading the disease? And so this is all underlying the contact rate in the epidemiological models. And this single parameter is kind of where all of these pieces fit together. Next. And the reason that it's important to combine some of this, social dynamics and population mobility data with the epidemiological information is because different diseases spread differently because of their epidemiology and biology. So these maps show the burden of disease of two outbreaks in Sierra Leone. One is cholera on the left and one is Ebola on the right. And you can see that in the same country, not that far apart, you've got very different patterns of disease. And so in the context of cholera, the resource allocation question is vaccine, right? Who do we vaccinate? How do we get vaccines to everyone quickly? And then how do we treat people that have cholera? On the right, it was Ebola. There was no vaccine. And so it was more about surveillance for preparing hospitals and keeping track of things. So again, this is why you kind of need some of these modeling approaches and combine it with the mobility data because different diseases are going to be different. Next. So many of you might be familiar with this kind of basic SEIR model that many people have used in the context of COVID. These letters just stand for susceptible, exposed, infectious, and recovered. They're very simple mathematical frameworks. And the way that they're integrated into a spatial framework is that you separate out populations that are linked through migration. So you have a kind of simple model, and then you're trying to use the mobility data to understand how infections might spread between populations that have different levels of a disease. Next. And so if you have epidemiological data that's relatively reliable, then you can create a mechanistic model like this and then make predictions about the routes of spread and introduction due to human migration and mobility. So this was a chikungunya outbreak in Dhaka that you're looking at. This is in Bangladesh. And so we're having an outbreak in the capital. And the question you want to ask is, where is this disease going to spread next? Where should I bolster surveillance? Where should I be ready for cases showing up in the hospital? So if you model a disease mechanistically like that, and then you can combine it with mobility data. So this is looking at travel out of the capital. Next. And you can produce a map that gives you a prediction on the introduction of the first case of chikungunya or first 10 cases of chikungunya in different parts of the country. And in that way, you can start being very targeted about your surveillance and very targeted about your hospital preparedness, right? So it's bringing together these different layers and being aware of the biases and uncertainties associated with the different data types to make a sensible prediction that can help decision makers. Next. This is Pakistan, and just to compare these approaches, on the left you have a risk map that shows you kind of before we had this kind of the data, which was which are the areas that might have an outbreak next based on climatic variables, and it's essentially everywhere. But if you combine it with how people actually move, you get a much more targeted risk map that shows actually you need to prepare hospitals in Lahore in the northeast because of the travel between Karachi in the south and Lahore in the north. So it's really just about tuning and focusing your efforts. Next. And we've talked a lot about monitoring non-pharmaceutical interventions. So I won't go into this, but it's similar to what Nishant was showing you before. This is data from Facebook, from Meta. Next. And the reason that this is important is because these shifting denominators change population density, and the population density is driving transmission. That's the underlying mechanism that creates epidemics. It's people coming together. So this map just shows people had traveled from Memorial Day, and we wanted to make a prediction about whether we think that there would be outbreaks in different places based on where they went. And again, it's just a population density estimate. Next. So lastly, just to say that one of the things that happens with population density is that when disasters happen, you get big changes in population density. And so you can have high epidemic risk in displaced populations on top of whatever's happened, whether it's a refugee crisis or a natural disaster like an earthquake or a hurricane. So if you think about this, just hypothetically, this is one of our situation reports with refugees coming out of Ukraine into Poland, and you can see where the population density has increased or decreased. Next. And then you can think about what was happening with COVID in Ukraine, where those refugees were coming from. They were in the middle of a big peak of COVID cases. Next. And Ukraine percentage vaccinated is like 35, right? So we learn on what we know about the epidemiology, and then we can understand what these big fluxes of data mean for what we need to do to support them, whether that's get vaccines, prepare clinics, make sure there are enough ventilators in the hospitals, and so on. Next. And then this is kind of the last point that I think we should really focus on this afternoon. Andrew and I did a project where we tried to make a predictive model because Cyclone Kenneth in Mozambique was coming off on shore. So we knew the trajectory of the cyclone, and we also knew the cholera risk in the different areas where the cyclone was going to hit. So we had a sense of the vulnerability to cholera in particular. We knew which way the cyclone was going. And the question is, how do you get a predictive framework so that you can preemptively get, cholera vaccines or whatever to places that are going to be hardest hit? Next. And this is the key, is that something like this, at the moment, takes multiple actors, different agencies, in this case, it was the Ministry of Health at WHO, Direct Relief and Net Hope were kind of NGOs sitting in the middle with the sort of medical supply chain. And then there was the academic partnerships as well. And these partnerships are clunky sometimes, and they require people, and they require, they have to be done ahead of time so that they can work smoothly. And I think for all of the things that we're talking about today, one of the key takeaways is, how do we structure networks like this in peacetime so that when bad things happen, we already can activate them quickly, and we can make sure that the data processing, the insights generated, get to the right people. And I think this is really a key challenge for Mexico, but generally for the world, is how we build these networks in a robust and sustainable way. Next, I think that's basically it. Oh, just to say that I would separate out the disease risks in particular into acute and chronic risks. So in the context of Ukraine, yes, we have COVID happening right now. We're going to need vaccines and ventilators, but there are chronic risks too. So after, as these new refugee populations move to Europe, we know they have a very high prevalence of XDR TB, highly drug-resistant TB. There's a lot of HIV. And again, trying to separate out the acute from the chronic impacts of these kinds of events can help us to figure out what we need to do methodologically in terms of data for both parts. Next. Okay, sorry, this is actually my last slide. So just to say that I know a lot of you are not infectious disease people, and I think that it's very, there are some key issues with data from epidemics that are actually different and you need to think about. The first is that the data is just a tiny fraction of the true burden, and in some cases really wrong. So the bias in the data can be bad. So the true disease burden, next. Then you have people that have symptoms. So a lot of infectious diseases, some people aren't symptomatic. Next. And then you have this smaller subset of cases that are both diagnosed correctly, reported in a timely fashion, delivered to the right government agency so that they have all the data, right? And that's why you need modeling sometimes. Next. And I should say you need good modeling, because there's a lot of terrible modeling. And that's something that has been prolific recently. Next. And then the other issue that's important for disasters is that where cases are reported is not necessarily where the person got sick. So because in epidemics, there can be a difference between where you got the disease and where you ended up reporting the disease, these displacement maps are really key, because we need to understand where the actual transmission risks are happening if you're going to intervene from a public health perspective. All right, and that's me. So I think next.
Does anyone in the public has questions?
I have a question. I think exactly it's for the last presentation. So, talk about like this ecosystems between the public sector, NGOs, and academia. What would be like one or two main roadblocks that you have identified for the creation of this sustainable network?
So there, one or two is consensus.
Yeah.
So I think, so first of all, I think that the data sharing agreements, the regulatory approvals, getting everybody on board in terms of from the data side, right? Understanding what aggregations are needed. So getting all of that set up before something happens is still, there's a huge amount of work to get there. And often I think that is very slow. So right now we're waiting on regulatory approval to use CDRs in the context of Poland, for example. And it just takes time because it has to go through ministries and get approval and letters of support and all this. So just that needs to be, the timeline needs to be shortened, and we need to work on the regulatory environment. And then I think, as we had said earlier, my opinion is that there's a very big gap in kind of local capacity. So we need more kind of technical people in government agencies or in partner institutions who can actually do this work and help decision makers. Because the reality is that as all of this, our world is getting more and more technical, the data sources are getting more and more complicated, the mathematics is more difficult, you know, it's all very sophisticated. But training to be an epidemiologist in a surveillance system somewhere in the world can't possibly learn all of those things. So that as the sort of scientific and academic and technical ability goes up, there hasn't been a shift in technical capacity locally around the world for public health and for disaster response too. So I think that there's a human capacity roadblock that's really important, and there needs to be massive investment in kind of training and structures to encourage those, we sort of call them data bilinguals, right? People that can have a foot in both worlds and understand how everything fits together. That's my, yeah.
So I echo all that was just said. In reference to Hamish's first presentation, where he displayed the St. Vincent and the Grenadines volcanic eruption, the shelters in the south, that was all pre-planned 6 months ahead, with working with the Seismic Research Center in predicting when the volcanic eruption will happen. The challenge then happened where 6 hours before eruption was the call to evacuate from the north. And the strategy of saying persons from District A go to shelter X was in theory perfect, but never materialized. And the chaos that happens with evacuations and disasters and population habits is really exacerbated in the reality. So the shelters then had a paper-based model for registering the people, which led to delays in analytics. So working with WFP and ITU, we then had to quickly digitize the registration process, and ITU, working with all the telecoms, spat out that in SMS format for persons to then register where they actually are. And that took about 6 weeks of work, which then hindered the relief distribution side of things. So the efforts to get things done early before actual impacts is needed in all aspects.
Yeah, I think, and everything tends to be reactionary, right? Because nobody really wants to invest. It's hard to get significant investment in something that hasn't happened. But I completely agree. And I think if we could think about data in the same way that we think about these other aspects of disaster response, and we've talked about simulation, whether you could incorporate the data piece and the data management piece into some kind of simulation frameworks, that would be helpful.
And one point on that.
Yeah, please.
So yeah, in Japan, we have earthquakes like every month. And so at the University of Tokyo, where I did my bachelor's and master's, we had this huge simulation program where there's, many hypothetical disasters that can hit Tokyo, for example. There's typhoons, there's earthquakes, there's anything. And we generated millions of scenarios for all of the types of disasters that we're expecting Tokyo to experience. And for all of those scenarios, we simulated the movements of evacuation patterns or displacement patterns of people across the Tokyo area and to the rest of Japan. So that's one type of preparation that we can do. We have tons of time before the actual disaster strikes. So preparing with various scenarios, and once the disaster hits, you can just look at what was the disaster, and you can look at the scenarios that we looked at. So that's kind of one way, technical, I think, way that we can prepare, I think.
Oh,
I ask you to maybe talk a little bit, both in the context of the modeling and the communications, how to effectively talk about the uncertainty in everything that you have kind of mentioned. That seems to be one of the, perpetual questions when it comes to, as you mentioned, uncertainty in the data, uncertainty in the models, uncertainty in, what the interpretation might be. How do you kind of address that?
I think it's one for me, like that was a huge part of my work, is trying to understand uncertainty and trying to actually deliver it in a reliable way. And I think for me, it was really targeting what's your largest source of uncertainty. So for example, you have uncertainty in everything like hazard intensity, population, etc. But it's trying to sort of pin down essentially, for me, a lot of it was actually population data. I found that different data sources corresponded well or better or worse. And actually having that, some of the plots that were presented earlier about daily changes in different regions, I think uncertainty in that is like, is really, really a crucial part. And trying to deliver it, not just understand it in your own model and what it actually shows in terms of what predictions of displacement will be, but actually like moving forward and presenting that in a way that's clear to decision makers.
I just say before I pass to you is, I do think that this is another place where understanding the use case is critical. So there are lots of sources of uncertainty, but which ones matter for the decision you're trying to make, right? Maybe and if you don't understand what the decision you're trying to make, then you don't know which pieces of uncertainty to ignore and which pieces to care about. And I think that's why, we found this iterative, trying to make sure that the relationship between the people doing the methods and the people making decisions is iterative, so that we're not just doing things in silos and then handing off a situation report that we don't necessarily have feedback on.
Yeah, I completely agree. And in Japan, because many of the cities are becoming, aging societies, and we're losing population. There's a really big incentive for cities to really smartly plan the allocation of hospitals, for example. This is not really in the disaster context, but in that scenario, we really, go back and forth with city planners using dashboards, and that turned out to be really effective in pinpointing, what uncertainties do we really care about, and what are the outcomes that are affected by those, right? So I think really bidirectional communication is really key.
Yeah, because scientists and academics tend to care about all things equally, and want all the data for all the things, right? And I think, but decision makers have to make a clear decision in a cloud of.
How do you incorporate the gender stratosphere? Because it's not just male, female.
Just a quick comment, because I think I should pass to mobility, those who work more specifically with mobility. But I think it is a really important question that in terms of just trends daily, in cities, it's often observed that, mobility towards on public transport as opposed to driving, women take routes that are differently. And I think really moving forward, you need to have first of all, a lot less men working in these sorts of environments as well, and actually having women representing that whole unspoken side. But yeah, I think.
Yeah, so Hamish actually is working with Meta to produce these gender disaggregated maps, right? So
I think Carlos should speak here more.
yeah, okay, yeah, but we're actually using that data, and so basically it tells us where people are going from to where in a kind of an OD matrix type of way, and that's disaggregated between men and women. And what we found is men tend to choose displacement destinations based on income or the wealth of the area, inequality, various social demographic variables, socioeconomic variables. But women, the single biggest predictor on how women choose their destinations was the social connectedness index, which was really interesting. And that tells you about, so that's how many friends you have in that city, and Facebook friends you have. So that difference is really, I think, really interesting. And that tells you how much economic independence women may not have when evacuating. So I believe that's really important fields to move into.
Yeah, just to say that this is really nascent. So like WHO only routinely gender disaggregated their data in 2019, right? This is, we have so far to go on this exact topic. In mathematical models for infectious disease, we assume it's random. We have no, generally speaking, it's not considered. And yet when you look in the data, any data on behavior, it's obviously gender is probably one of the biggest indicators for how people move differently. And so I think this is a really key research area, as well as this operational stuff. I think that there's just a huge amount of research that needs to combine traditional surveys, really kind of understand the details of this.
One more question? Oh, sorry. Yeah.
Yeah.
Gracias. Creo que en la misma línea de... Sorry.
Sorry.
Sí.
Okay. Creo que en la misma línea de la incertidumbre de la que hablaban, hay un elemento que hay que considerar, y es que no todas las personas actúan de igual manera, ¿no? Y esto es importante al momento de considerar los desplazamientos. Y, por ejemplo, las personas migrantes irregulares que se encuentran en un país pues diferente al suyo de origen, ¿no? Cuando se ven afectadas por un desastre, pueden no tener la misma reacción que tendría una persona residente legal o incluso migrante regular del país. Por ejemplo, en México se podría hacer lo mismo que decía Taka, ¿no? De poner los refugios o los espacios en donde se va a atender a las víctimas con antelación, previendo sitios seguros, pero sabemos que si el ejército se encuentra resguardando esas facilidades, es muy poco probable que personas migrantes en situación irregular se acerquen a esos sitios porque consideran que pueden ser deportadas, ¿no? Entonces, eso también tiene que ver con, al momento de diseñar las políticas públicas, de cómo pensar en hacerlo accesible a otras poblaciones y tratar de reducir esa incertidumbre, y yendo no solamente más allá del género, sino ver como toda esa interseccionalidad para poder atender a estas poblaciones con situaciones muy específicas, pero que pueden llegar a ser súper amplias, como lo han mostrado, por ejemplo, las caravanas que atraviesan México y que pudieran enfrentar alguna situación de emergencias.
I can speak to this a bit. I think this leads in well into the next session, because during COVID in the US, we had a situation where we were being asked by police agencies to provide them information about who was going to protests, which neighborhoods were being represented in the Black Lives Matter protests. Obviously, we did not share that information, but this is very important because, the reality is that this data can be sensitive. And so the more disaggregated you get, the more you run into risks of misuse of the data. There is a very fine line between state surveillance and public health surveillance sometimes. And I think this question about vulnerable groups, whether it's because they're illegal or whatever else, is something that at the moment field is still grappling with how to understand this. I don't think that there's a clear answer right now. For the Ukraine crisis, for example, there's an example of a mobile operator giving SIM cards to refugees, and then you would have a stratified data set, right? I think it's really probably a kind of political question as well. And so when we talk about privacy and best practices, this is something I hope we can talk about, because it's there's a kind of flip side of the coin. You want data to provide access to vulnerable groups, but you also need to be aware that that data could pose risks to them. And so I think this is a very important topic for us to discuss. I don't know if you have.
Perfect, thank you very much.
Sure.
So with this, we can move actually to the next panel, that is
Okay.
on data privacy and responsible practices. You're not aware.
Oh, I'm moderating. It's okay.
So
Fine.
we have, if you want, I can put Stefan video first, and then we can go with.
Yeah, do you want to do it that way?
Yes.
Fine.
Is this one of the panel